Dr. Leah Powers in Plover, Wisconsin. This is another add-on related to the COVID. Sometimes people have diarrhea when they have COVID. And my mom worked as a registered nurse starting in about late 40s. And so there, if somebody would come in with diarrhea, this was, 70 years ago, they would get the black tea and toast treatment. So they were having trouble at home, and so they come there, and then they would they'd boil the water, let the teapot whistle, and then let it cool off a little bit, and then you make your black tea, and then they'd get black tea, and then they'd get some toast. And so they stayed at the hospital like that, and after they'd start getting a little better, after a couple days, they quit tooting, they were fine. Then they would get a little jam on the toast, and then they continue with the black tea and toast for another day or so, and then they're really tired of not eating, and so then they got to start to eat, and then they would be able to go home. And so that was the treatment that they used 70 years ago for diarrhea, which would be some type of flu symptoms. And so protozoa will cause diarrhea. That's one of the symptoms that you can get with it, flu symptoms. So another thing you could do that would help to remove the protozoa is to boil your water for 6 minutes or for a period of time, and then that would help. That's an old treatment that was used before that worked just fine, and so why not use something that's already been used for 70 years to get better? So if you got this problem, just give that a try and see if that's helpful. There's some chiropractic treatment that does help with post-COVID syndrome, some of the brain fog, etc. But basically, you gotta, eat your food. It's got to stay there for a while, and then it's got to come back out.